Men teasing each other and hitting the gym.
What exactly is gynaecomastia?
Exercise and weight loss can reduce fat, but they don't remove glandular breast tissue. Some bodybuilders who resort to anabolic steroid enhancement to try and build muscle find instead that the body acts against them.
Gynaecomastia, or male breast enlargement.
Up to 60% of men will experience it at some point in their lives. If male breast enlargement is bothering you,
Kia ora, and welcome back to the Cutting Edge Plastic Surgery podcast. Today we're talking about a condition that's far more common than many people realise: gynaecomastia, or male breast enlargement. It can affect teenagers, adults, and older men. And for many, it causes discomfort, self-consciousness, or confusion about what's actually going on. To explain what gynaecomastia is, why it happens, and how it can be treated, I'm joined by specialist plastic and reconstructive surgeon, Dr. Adam Greenbaum. Adam, welcome.
hi Nicola.
Let's start with the basics. What exactly is gynaecomastia?
I think the first thing to understand, and it's what embarrasses many men when they come to talk about gynaecomastia, is that they don't realise that men having breast tissue is quite normal. It's important to realise first that both men and women have breast tissue when they're born. As girls develop into women, estrogen causes their breasts to grow to their adult size. Because boys have more testosterone, their breasts don't grow and become functional in the same way that women's do. So people joke about male breast growth. The common term these days is man boobs or moobs. But in essence, we're talking about the benign enlargement of male breast tissue when we talk about gynaecomastia. It's important to understand that this is not simply excess fat. True gynecomastia involves the growth of glandular breast tissue, which is often combined with fat. It's very common. Up to 60% of men will experience it at some point in their lives.
So what causes gynecomastia?
The most common cause of gynecomastia is a hormonal imbalance between estrogen and testosterone, and this can occur absolutely normally during puberty, but also in adulthood and later in life. It can be associated with certain medications, with some medical conditions, and changes in weight. In adolescence, it's often something that resolves as soon as puberty passes and hormones settle. But in adults, it's more likely to persist. That's why assessment is important, because to understand what type of tissue is present and whether treatment is appropriate is critical then to going on and treating it appropriately.
So more complex than people would realise. So many men assume it's just weight related. How do you tell the difference?
It's a very common assumption and a misconception, and it leads to men teasing each other and hitting the gym, and some proportion of what we see is simply a manifestation actually of obesity. But certainly not all of it, and it's complicated because the more overweight you are, the more your fat tissues act to increase breast size. Testosterone is metabolized within fat to make estrogen, which in turn stimulates the growth of breast tissue. So, obesity does start to become a self-fulfilling cycle towards increased breast growth, both in men and in women. Fat deposition on male chests tends to be soft and diffuse across the chest, whereas glandular tissue is usually much firmer and it sits directly beneath the nipple and areola. Exercise and weight loss can reduce fat, but they don't remove glandular breast tissue, and they certainly doesn't remove the stretched skin, which remains and droops. So if the enlargement persists despite good fitness and stable weight, gynecomastia may be the cause.
So when should someone consider getting it checked?
If male breast enlargement is persistent, if it's asymmetrical, if it's painful or tender, or affecting confidence or comfort, then it's certainly worth getting it assessed. The first step always is to rule out an underlying medical cause, and one critical diagnosis to rule out immediately is breast cancer. Overall, 1% of all breast cancer occurs in men. Now, in New Zealand, with our population, that translates to somewhere between 25 and 26 men each year. Other treatable causes to look for and to deal with include some medications. There are diseases that alter hormones in various ways, general obesity, as we've discussed, and of substance abuse. Some problems just stem from marijuana use and alcohol consumption, and ironically, some bodybuilders who resort to anabolic steroid enhancement to try and build muscle find instead that the body acts against them and converts that to estrogen and breast tissue growth. So once all that's been ruled out, we can discuss surgical management options.
That's great advice. Are there non-surgical treatments?
If medication or a temporary hormonal change is the problem, then addressing that helps. Once that's all been sorted out, if gynecomastia persists, surgery is really the only definitive treatment. That's why timing and diagnosis matter.
And what does surgical treatment involve?
Surgery addresses the removal of the excess glandular tissue and, where necessary, fat. May involve direct excision of glandular tissue, liposuction, a combination of liposuction and excision, but also redraping of the reduced skin. Incisions are usually small. They're usually placed around the edge of the areola, and they are done in a way to keep scars discreet. But for patients after drastic weight loss, those scars will be much more extensive. The goal really is to give someone a flatter chest contour and to reposition the nipple where necessary.
And what should patients expect during recovery?
The surgery is performed under general anaesthetic. Most patients will go home on the same day, occasionally after an overnight stay if they've had an extensive procedure after massive weight loss. Compression garments will be worn, and those need to be on for several weeks to support healing and reduce swelling. Bruising is normal and variable. There'll be some transient numbness on the chest, but most men will find that disappears over a few months. A return to gentle exercise is usually within a couple of weeks. But more vigorous exercise may take 2 or 3 months to be back to normal.
And are the results permanent?
Or yes, provided the underlying cause has been addressed. Once glandular tissue is removed, it doesn't grow back. But maintaining a stable weight and addressing hormonal factors helps preserve the result over the long term.
And who tends to be a good candidate for surgery?
Men need to have a stable weight and to have completed puberty, being in good general health, and certainly someone with persistent gynecomastia that hasn't resolved after all of the treatable causes have been addressed and removed might like to consider this. It's important that men understand the procedure and the recovery involved.
And what defines cutting-edge plastic surgery's approach?
Gynecomastia can be a really sensitive issue to talk about, so consultations are handled carefully and privately. The advantage of a specialist plastic and reconstructive surgical training means that managing both the functional and the aesthetic aspects of chest surgery are integral. It's important to recognize when further investigation is needed and rule out those causes and treat them. So my follow-up is very thorough. I support patients from start to finish.
That's good to know. So to finish, what are the key messages for our audience?
Gynecomastia is a common medical condition, and it's not a personal failing. Exercise alone can't remove glandular breast tissue that's grown and hypertrophied. Surgery can be very effective and appropriate for the right patients. If male breast enlargement is bothering you and causing discomfort, it's certainly worth having a conversation about it.
And our audience can learn more or book a consultation at CEPS.nz.
Absolutely. Yes, you can book a consultation through cuttingedgeplasticsurgery.nz, and we'd be very pleased to see you.
Dr. Adam Greenbaum, thank you for joining us.
It's my pleasure.